Your patient's in cardiac arrest. The family's hysterical. You have seconds to make a move. You reach for a life-saving drug, but in the chaos, you grab the wrong one. Is it a simple tragic mistake or is it something worse? Now let's rewind. Same patient, same chaos. But this time the provider knows they're cutting a corner. They know they aren't doing what they should. So where's the line between a forgivable human error and an unforgivable act? That's the question we're digging into today. In EMS, you live on the knife's edge, where every single decision can be the one that matters most. Every provider has a deep-seated fear of making a mistake, but there's a world of difference between an honest error made under pressure and a deliberate betrayal of a patient's trust. One is about being human, the other is a conscious choice to lie or deceive, and it's what many of us would call one of the true deadly sins of our profession. Figuring out that difference is critical, not just for us in the field, but for every person who trusts us to show up on their worst day. Let's paint a realistic picture. A paramedic crew is working a multi-car pileup on the freeway. It's pure chaos. One medic, we'll call him Alex, is trying to treat a 7-year-old boy with a badly fractured leg. The child's in absolute agony. Alex knows he needs to give pain medication and fast. But in the middle of the noise, the stress, and with resources stretched thin, he messes up the weight-based calculation. He gives a dose that's slightly too high for a kid that size. For a few terrifying seconds, the child's breathing slows down dangerously. It's okay. BVMs exist. Alex saw the mistake happen in real time and immediately started helping the child breathe. And the boy was stable again within a minute. Was it a serious error? Without a doubt. But was it malicious? Not a chance. This is a classic gut-wrenching example of an unintentional medical error. These are cognitive slip-ups that can happen to the best of us, especially when you factor in extreme stress, exhaustion, and flaws in the system itself. Legally, there's a big difference between simple negligence, making a mistake, and something more sinister. To prove negligence, you usually have to show that there was a duty to act, that duty was breached, and that the breach directly caused harm. Alex made an error, yes, but he never intended to hurt that child. It was a failure of performance under incredible pressure. Afterwards, the goal isn't just to blame Alex, but to look at the whole picture, the training, the protocols, and the support systems to make sure it doesn't happen again. Now let's look at a completely different kind of failure. Picture a paramedic, Sarah, at hour 23 of a grueling 24-hour shift. A call comes in from a nursing home for a patient with altered mental status. This patient's a frequent flyer, someone who calls 911 often for things that aren't emergencies. Sarah's exhausted and just wants her shift to be over. We've all been there. She does a quick half-hearted exam. She then charts a full set of normal vitals, the blood pressure, the pulse, the works, even though she never actually took them. She talks the patient into signing a refusal and goes back to the station. A few hours later, that same patient is found to have had a massive stroke, a stroke that a real assessment might have caught. So what Sarah did wasn't a mistake. It was a conscious choice. Falsifying a medical report is one of the ultimate betrayals in EMS. Now, some might call this malice, but in legal and ethical terms, it's more precisely defined as gross negligence or willful misconduct. Malice usually implies you intended to cause harm. What Sarah did was intentionally deceive, putting her own convenience above the life of her patient, a reckless disregard for their safety. This isn't an error of commission, like doing a skill wrong, or an error of omission, like forgetting a step. This is an act of fraud. This is the line that can never be crossed. This is the kind of willful misconduct that truly undermines the trust that people have in all of us in EMS. This is the unforgivable sin, the deliberate choice to betray the uniform and the person who called you for help. That to me is a huge line. That is the uncrossable line. Making a medical choice in a selfish way to make your job easier, to make your day shorter, to make your scene faster, whatever it is, for a selfish reason, is the difference between a reasonable error that needs to be corrected and a unforgivable sin. So the line between an honest mistake and a selfish act can seem blurry from the outside, but it's a line that every single provider has to walk. What do you think? If you're in the field, how does your service support you to prevent simple mistakes from happening? If you're not, does this change how you see the pressures first responders are under? Let me know your perspective in the comments. Every person who puts on an EMS uniform accepts that they're human and that mistakes can happen, even with the best training and intentions. The systems we work in are supposed to be there to catch those errors and help us learn from them. Help others learn from them too. But the one thing no system can or should tolerate is a provider who knowingly cuts corners, lies on a report, or acts out of pure selfishness. The unforgivable sin in EMS isn't making a tragic error, it's a conscious betrayal of a patient's trust. I'm Angry Bill. This is Pre-Hospital Wisdom, and until next time, do the right thing.